Hi, my name is Julia Curran, and my presentation was on thoracic aortic aneurysms, also known as TAA. What is TAA? TAA is the widening of the aortic artery due to the weakening of the aortic wall. From force, blood splits the aortic walls, allowing blood to leak between them, resulting in an aneurysm. It is the 18th most common cause of death in the U.S., and there are no single causes of TAA, but it can be the result of the following: atherosclerosis, which is the hardening of the arteries from plaque buildup; genetic conditions, which are inherited disorders passed down by family members; blood vessel inflammation; or traumatic injuries from falls or motor accidents. The role of the aorta. The aorta is the largest artery in the body, and the aorta carries oxygen-rich blood from the heart to the rest of the body. Shown in the picture, I've boxed where the aorta is in the heart. The quality of the wall structure in the aorta is imperative for how the aorta will function. Aneurysms. An aneurysm is formed when the aortic wall becomes weak from plaque, connective tissue, or other factors. When the systolic pulse is sent through the aorta, this could place stress on the wall, which can lead to an aneurysm. So this is a picture of a stent that was put in because of an aneurysm through the stress on the wall, and this will help with the aorta function. Genetics and aneurysms. It is seen that conditions that cause TAA can run in families. If you are a first-degree relative, such as parent, brother, sister, son, or daughter, that have a condition linked to TAA, you should receive screenings. Individuals with Marfan syndrome are more likely to be diagnosed with TAA compared to individuals without Marfan syndrome. Conditions linked to TAA are Marfan syndrome, Loeys-Dietz syndrome, Ehlers-Danlos syndrome, and Turner syndrome. These are all connective tissue disorders that target collagen in your body. Collagen provides structure, strength, and support. Progression of TAA. On the left is a picture of a normal chest x-ray, while on the right is a picture of a chest x-ray with someone who has TAA. So a statistic from the BMC cardiovascular disorder. TAA is mainly a slow-growing disease with an estimated growth rate of 0.12 centimeters a year, varying based on the aneurysm location. Sheriff Kazami. TAA usually starts out small unless other risk factors are involved, which can increase symptoms and come upon faster. Over time, as more stress is put on the aortic walls, the blood vessels will become enlarged and weak. Once the aneurysm is formed, the size gradually increases, which puts you at a higher risk for rupturing or dissecting. Symptoms of TAA. You will feel pain in your jaw, chest, neck, or upper back, wheezing, coughing, or shortness of breath as a result of pressure on the trachea, hoarseness as a result of pressure on the vocal cords, and trouble swallowing due to the pressure on the esophagus. Diagnosis of TAA. So on the left shows 4 different scans of TAA that show that the aortic walls are enlarged. So doctors will complete a full medical history as well as physical exam. Types of diagnosis include CT or CAT scans, MRIs, echocardiogram, and chest x-ray. You should receive scans and tests every 6 months or one year to look for growth. The effects of exercise on TAA. Why exercise? No research has been shown that exercise decreases TAA size or that exercise reduces the chances of developing TAA. Atherosclerosis is the most prevalent cardiovascular disease in an individual with TAA. So exercise can help fight atherosclerosis by reducing fat in your blood, lowering blood pressure and cholesterol, therefore controlling an individual's weight. Individuals with TAA should exercise to improve strength of blood vessel walls, lower blood pressure, help maintain a healthy weight, and lower inflammation that might slow the growth of aneurysm. Disease linked to atherosclerosis is the leading cause of death in the United States. About half of Americans between ages 45 and 84 have atherosclerosis and don't know it, from the National Institutes of Health. So how TAA affects exercise response. On the right is the recommendations for sports and surgery in Marfan syndrome specifically. So aortic aneurysms that are below 40 millimeters You should avoid high and very high intensity exercise, contact, and power sports. So the preference is endurance. The follow-up should be 1 to 2 years and surgery is not needed. 40 to 45 millimeters, only skill sports or mixed endurance at low intensity should be done. You should be checked every 6 months to 1 year, and surgery is not recommended unless you are in the category of high-risk factors such as Marfan syndrome. For 45 to above 50, no sports are recommended. You should be receiving surgery and should be getting follow-ups every 6 months. So in this quote, it says, in particular, the increased systemic blood pressure and aortic stress during physical activity in patients with genetically triggered aortic disease could be responsible for aortic rupture or dissection, which is responsible for cases of sudden cardiac death in athletes. So the higher your blood pressure is when you exercise, the more at risk you are for developing an aneurysm. So management. TAA is a chronic disease in which it cannot be cured. Medications such as beta blockers, statins, and if needed, angiotensin II receptor blockers. Beta blockers are most commonly used and help decrease your heart rate during exercise. Angiotensin II receptor blockers are used if beta blockers cannot be taken. They have no negative effects and they also help decrease heart rate. Statins help lower total cholesterol, but they can have side effects of taking them, such as muscle soreness. Also, minimally invasive surgeries such as stenting can be done, as well as, if needed, more complex surgeries to replace the affected part of the aorta can be done. So for the common medications and how they affect exercises, on the left, you see the statins. The no treatment, there are a surplus of LDLs, which are your bad cholesterol. So there is a buildup of plaque that gets stuck, which blood flow cannot be done with no treatment. With statin treatment, more cholesterol is absorbed from circulation, so that means that there is less LDL in your circulation. When we look at the beta blockers slow SA nodes, which initiates the heartbeat. So, beta blockers slow heart rate and lower blood pressure. So for my case study, I spoke with my client, which was 60 years old and a male. He was a smoker for 10 years. He has a BMI of 28.6, an LDL of 188 milligrams, and an HDL of 45 milligrams. So after speaking with my client, I was able to gain more knowledge about his family history, which he has no history of TAA, and his exercise history, which he has a very sedentary lifestyle. He is having trouble moving around to do his daily activities since he is overweight and a smoker. He is also really upset when he talked about his grandchildren and how he was unable to play with them. He said he wants to be able to move around more and be able to be more present in their lives. A medical clearance is needed for him. So his goals are to do more household chores and to be able to play with his grandchildren. The risk stratifications. So these are all risk stratifications for the general population. But specifically for my client, the non-modifiable are the red ones. So the sex, him being male, and his age, since he is above the age of 55. For modifiable, he has the risk of high blood pressure and cholesterol levels, as well as tobacco use and being overweight. So for the exercising testing for my client, for the cardiorespiratory endurance, I chose the 6-minute walk test. Since he has a sedentary lifestyle, I chose the 6-minute walk test to help me gain more information that I need while keeping my client safe. For muscular strength, I chose the hand grip strength test. This is to test your upper body strength, and it is easy for the older population to do, and it is a very reliable test. For flexibility, I chose the chair sit and reach, as pictured on the right. The chair sit and reach is meant for the older population to help with hamstring flexibility as well as lower back flexibility, which is especially important for older adults. This reduces the risk of lower back injuries. For muscular endurance, I chose the 30-second arm curl or the chair stand, which is also pictured on the right. The 30-second arm curl helps with everyday activities such as picking up and carrying groceries or picking up grandchildren. For my body composition, I chose the skin fold and abdominal circumference assessment. I want to use this test since it is easily accessible and the cheapest. I'm looking for abdominal fat the most, which is the area of most concern for fat, and that is done with the abdominal circumference assessment. For balance, I chose the 8-foot up and go test. Balance is very important in older adults. For the test, you set a marker 8 feet out. You have them sit down. When you say go, they stand up. They walk around a cone while keeping their balance and sit back down. Balance is used within everyday activities such as walking, standing from sitting, or going up the steps. So for my exercise prescription, I chose for my aerobic frequency 3 to 5 days a week. My intensity should always be moderate, so that's 75 to 85% of max heart rate. The time, it should be done 30 minutes a day, so my client can either choose to do it all at one time or in increments of 3 10-minute exercises. For the type, I chose the warm-up of 5 to 10 minutes of light walking and 30 minutes of moderate walking. For resistance, I chose frequency between 2 to 3 days a week. Intensity should be 40 to 50% of your 1 RM, which is moderate intensity, for 12 to 15 reps for one set. That should take about 20 minutes. And for type, I chose for lower body since my client will be doing overall body exercises, squats, lunges, RDLs, upper body, overhead press, Arnold press, dumbbell back row. For core, knee tuck extensions, standing elbow to knee crossover taps. For flexibility, for the frequency, I chose 2 to 3 days a week. For my intensity, my client should be holding a stretch until slight discomfort or tightness. For time, that should be about 10 to 30 seconds. For type, dynamic and PNF should be done before exercising, while static or dynamic should be done after. Modifications necessary for safe exercise. Safe exercise is especially important for my client because if blood pressure goes above 160, that can be dangerous for my client and they can develop a thoracic aortic aneurysm. So, frequently checking blood pressure throughout exercise to ensure numbers are normal is highly important. Also, light lifting is more beneficial than heavy lifting. This is because you should not be holding your breath when exercising. When you hold your breath, your blood pressure and your heart rate start to increase, which is very bad for my patient. So we are going to be picking exercises that do not increase the chances of him holding his breath during exercise. And if needed, we should be decreasing intensity and increasing duration of exercise. So we could go down to a 20 to 30% intensity and doing it for 50 minutes. So what to watch for during overexertion, which is something that you do not want to get to the point of your client doing. They will have severe shortness of breath, chest pain or tightness, unusual or extreme tiredness, dizziness or lightheadedness, and fast or irregular heartbeat. So in conclusion, you can exercise when having TAA, but you should be monitored closely. Healthy living is the key to decreasing chances of developing TAA, and you will be able to always change your habits. And these are my references.